Hey everyone, today we're going to break down the VA compensation and pension exam for the cervical spine. That's just the official term for your neck. We're going to walk through this whole thing step by step so you know exactly what's coming and what to expect. You know, the goal here is pretty simple. We want to pull back the curtain on this whole process. From getting your paperwork ready beforehand to what actually happens during the physical part of the exam, we want you to walk in there feeling confident and ready to clearly and accurately talk about your condition.
So here's our game plan. We've got this broken down into 5 main parts. First, we'll look at the exam's framework itself. Then, we'll cover preparing your evidence, how to discuss your condition, what happens in the physical examination, and finally, we'll wrap up with how to communicate effectively.
Okay, first things first, it's really important to understand that this exam isn't some random, free-flowing conversation. Not at all. It is highly structured, and the examiner is following a very specific form. And honestly, that's actually great news for you, because it means you can know exactly what's on the test before you even start.
So what is that form? It's called the Disability Benefits Questionnaire, or just DBQ for short. For your neck, it's a pretty detailed document. We're talking 14 pages. You can think of it as the examiner's playbook. Its whole purpose is to make sure every single veteran is being evaluated using the exact same playbook, which ensures the whole process is consistent and fair for everybody.
So knowing that the exam is so structured, how do you prepare? Well, listen, the most important work you're going to do actually happens before you ever walk through that clinic door. You want the examiner to have a complete, total picture of your condition, and that means making sure the VA has already gotten and reviewed all of your relevant medical evidence. A really solid evidence file usually has 4 key pieces. First up is your statement in support of claim. This is where you get to tell your story. Then you've got imaging reports, MRIs, CT scans. Those are fantastic for soft tissue stuff. Third, if you have that radiating pain down your arm, nerve studies can offer some objective proof of that. And finally, don't forget your physical therapy records. These can be absolute gold, especially if they happen to measure your range of motion during a bad flare-up.
All right, so you've submitted your evidence, it's exam day, and you're in the room. The first thing that's going to happen is a detailed conversation. The examiner is going to use your file and your own words to really get the full history of your neck condition.
So you'll want to be ready to tell that story. How did it all begin? Have your symptoms changed or gotten worse over time? What have you tried for treatment? Medications, PT, injections? They'll want to know it all. And they'll also ask if you use any assistive devices, so be sure to have that info handy.
Now, there's a specific term I want to highlight because the DBQ asks about it directly, and that word is flare-ups. A flare-up is just a temporary period where your symptoms get a lot worse, and it really impacts your day-to-day life. So be ready to talk about what might trigger them for you, how often they happen, and about how long they usually last.
And this brings me to maybe the most important part of this whole conversation. You can't just say, my neck hurts a lot. You have to translate that pain into a real-world problem. Saying that the pain literally prevents you from turning your head to check your blind spot while driving, now that gives the examiner a crystal clear picture of your functional loss.
Okay, so after you've talked through your medical history, the exam kind of shifts gears. It transitions into the hands-on part. This is where the examiner is going to physically assess your cervical spine.
This part usually starts with what's called inspection, where they'll just look at the alignment of your spine, and palpation, where they'll gently feel the muscles and bones around your neck. But the main event here, the real focus, is the range of motion testing.
So how do they measure your movement? They use a special tool called a goniometer. Yeah, it looks a little bit like a protractor from back in school, right? Its whole job is to get a precise, objective measurement, a number, for the angle of your neck's movement. The first movements they're going to measure are flexion. That's just moving your chin down toward your chest, and extension, which is looking up toward the ceiling. Just as a reference point, for most people, a normal range is about 45 degrees in each of those directions. Next up, they'll check your lateral flexion. This is just tilting your head, trying to bring your ear towards your shoulder, but without actually raising your shoulder up to meet it. And again, for this one, the normal range is considered to be about 45 degrees to the left and to the right. And finally, there's rotation. This one's simple. It's just turning your head to look over your left shoulder and then over your right. This movement actually has the biggest range of all, with a normal measurement being around 80 degrees in each direction.
Now, if your condition involves nerve issues, what doctors call radiculopathy, the examiner is also going to do a neurological assessment. This means they'll test your muscle strength in your arms, check some reflexes, and even map out any areas where you feel numbness or tingling. They're basically playing detective to see if a specific nerve is being affected in your neck.
And that brings us to our final section, which honestly might be the most crucial one of all. We need to talk about your role during the physical part of this exam, because how you communicate right here is absolutely vital. Okay, if you only remember one thing from this whole explainer, please let it be this. This is not a test of how tough you are. It is not about gritting your teeth and pushing through the pain. The VA is measuring your functional loss, and that includes any movement that is limited by pain. It's all about identifying the exact point where pain begins.
So, as the examiner is having you do these movements, the second you start to feel pain, you stop. You stop the movement right there, and you calmly say it out loud. Something simple and direct, like, "Here is when I start having pain." That's all you need to do to communicate it clearly.
And look, it's important to know that the examiner's assessment isn't just about that one moment on that one day. They are required to use their clinical judgment. They have to factor in your entire medical history to consider how things like repeated use or a bad flare-up would limit you on any given day. When it's all said and done, everything we've talked about really just comes down to this one question. When you take the time to prepare your evidence thoroughly and you communicate your functional limits clearly, you're doing everything in your power to make sure the answer to this question is a confident yes. Is your evidence telling the full story of your condition?
So how does the VA actually rate neck conditions? Let's break it down.
Well, for most neck issues, it really comes down to one thing: your range of motion. This is for common stuff, like cervical strain or even degenerative arthritis.
The VA basically looks at your movement versus what's considered normal. For bending forward, that's 45 degrees.
Okay, so if you can only bend forward 15 degrees or less, that's a 30% rating.
You're looking at 20% for moderately limited forward bending or if your overall movement is restricted.
And a 10% rating, that's for less severe but still documented limits on your motion.
But what if your spine fuses and just doesn't move? That brings us to ankylosing spondylitis.
Ankylosis is just that, vertebrae fusing together. The VA rates it based on the position it fuses in.
If it fuses straight, that's favorable. But if it's fixed in a bent position, that's unfavorable.
And unfavorable isn't just a word. It means real daily problems, like the ones you see here.
So for your neck, an unfavorable fusion gets you 40%. A favorable one? That's 30%. All right, let's switch gears to IVDS. It has a totally different way of being rated.
This is really specific. It's for a herniated disc that's actually compressing a nerve root.
And get this formula isn't about motion at all. It's about periods of prescribed bed rest.
So what's an incapacitating episode? It's when a doctor has to put you on bed rest.
Your rating is based on the total time, in weeks, you spent on that prescribed bed rest.
So if you have IVDS, which formula does the VA use? Range of motion or bed rest?
Here's the great part. The VA has to give you whichever rating is higher. It's the rule.
So, the takeaway? Know how your neck is measured. And for IVDS, remember, you have 2 shots at a rating.
It all comes down to this: which method truly tells the story of your condition?
Like this video if it helped you. Hit subscribe for more disability exam prep content. Send this to a veteran who has a CNP exam coming up. Check out valorforvet.com for more resources. See how the team of medical experts at Valor for Vet may be able to help with your VA disability claim.